2021 budget until a formal budget is approved and adopted.
I move that we continue to operate under the 2020-2021 budget until the budget for this year is adopted.
So a motion and a second, to operate and continue budget resolution. Motion by Ms. Hinkle, second by Alderman McDuffie. Yes. All right, motion approved. Thank you.
Okay, Dr. Weicker is going to cover the custodian and temporary employee pay.
With assistance and support from Ms. Jones.
Yes.
So as we wait for Dr. Weicker to come up, we started having conversations regarding the fact that it was very difficult for us to maintain custodial staff, part-time custodial staff, or temporary custodial staff, because folks were staying home or going to other jobs that were paying them significantly more money. And so we started looking at the wages in the areas in which these folks were going. And so we'd like to make a recommendation to the board to increase those hourly wages to $13 an hour. And so Dr. Weicker is going to share with you what he has come up with.
Thank you. I apologize, I got my mask. Currently, we have 10 custodians who make less than $13 an hour. Just as a reminder, our salary ranges are based on the state guidelines. As a general rule, most systems in our area since the recession offer our state salaries towards the lower range. They do not have steps like teachers do, on a 0 to 30 or 0 to 15 scale. So we have our set scales based on the more, like right about the minimum or just slightly above. So what we're recommending is raising our 10 custodians who are currently making less than $13 to $13 an hour. When looking at that, it creates the domino effect. We look at our next group up, or the next pay grade up, which would be our teacher assistants. And currently, we have 28 teacher assistants at that base pay, meaning they have 48 hours where they are grandfathered in from the college credit requirement pre-No Child Left Behind. And we have 28 of those to $13 hours as well. So if you look at the cost there, we'd have a cost of about $38,574, an increase in their current salary. Of course, it's just not their salary. We have to include FICA, which is Social Security and Medicaid, Medicare, excuse me, and then an increase in retirement. It's 22.727%. When we presented this at the budget retreat, it was the last thing on the agenda. We kind of went over it quickly. At that point, it was 21.68. We do have some mini budgets going through, so we know what that rate is going to be. So a total out-the-door cost would be roughly a little over $50,000 or $50,115 to the district. This will make us more competitive. We posted 5 custodian positions when the board approved it for next year's budget. In those 5 openings, we had 13 applicants. In comparison, in December when we had 1 opening at the middle school, we had 18 applicants. So you look at those numbers, these positions were posted much longer, and we filled the middle school position back in December, January, less than 3 weeks. We're just looking at when you drive around, there's a restaurant in town that actually pays drive-through people $12 an hour. People who close $13 an hour. Now, the one benefit we offer is we have health insurance and our pension plan and retirement system. So there are some benefits. Even our temp agency is struggling to find employees to staff our schools. So we feel this will make us more marketably competitive, and also gets us closer to a living wage. It's right. It's just right that we treat our employees right, and that's all employees. That's not just teachers. It's everyone.
And so as you,
I'm sorry.
as you see that grand total down there is a little more than $50,000. As we have been in communication with the county manager, we are expecting to receive additional supplemental dollars. And remember, we use those supplemental dollars to staff some of our bonuses. We are expecting in the neighborhood of about $85,000 in additional supplemental dollars. And so that would clearly cover the cost of bringing our temporary custodial staff up to a living wage.
What are the Red Circle employees?
Red Circle employees are folks that do not necessarily meet the regular pay scales. They're higher than their normal pay scale.
Okay. So they're above the $30 an hour?
That is correct. They're above, but they actually don't have a scale attached. They were hired under the previous administration, and some of their salaries were set differently.
Okay.
So I thought with our supplemental tax dollars, the majority of that was focused at the bonus supplemental pay and not necessarily hourly wages or wage.
That is correct. We can use those dollars however.
We can use it however we want.
Right. So right now, we're using them to pay bonuses
Yeah.
for the most part. And so with the additional $80,000, then we'd like to use that additional money to cover this $50,000.
Well, I make a motion that we accept the proposed rate increase.
So a motion by Vice Chairman Byrd to accept the proposed rate increase. Well, I don't know. Got a second by William Wardell. Motion approved. Thank you, Dr. White, Ms. Jones. Next thing, Board of Education, East County Department of Health and Human Services. Ms. Lillian.
Good evening.
Good evening.
Great to see everyone. It's nice to be back in person for meetings. I'm tired of looking at folks on Zoom, so I appreciate the opportunity to share this space with you tonight. Dr. Wells asked me to come and just kind of provide an update for you guys with where we are with COVID-19. On Monday, Dr. Wells and a couple of folks from the school system came and visited us at the health department with our other two school systems in Davidson County to discuss the new updates to the Strong Schools North Carolina toolkit. That toolkit is sort of the playbook for how all public schools and private and charter schools in North Carolina can operate safely to protect the health and well-being of children who are in the school system, your faculty, your staff, and then everybody that they go home to. The document is long, It has a lot of different pieces, but we were able to tease out some of the really important parts, and I wanted to share those with you guys tonight. The toolkit talks about everything. It talks about how to open school safely, how to clean school, how to handle positive cases, how to do isolation and quarantine. It talks about testing. But the things that I found most beneficial for a group like you to hear is that this year they've made some significant changes from last year, particularly when we talk about quarantining once we have a positive case. In Davidson County over the last 3 weeks, our cases have tripled. We track a 10-day new case number, and we post that weekly. The reason we do that is a case typically runs 10 days, and so that's sort of our rolling active cases. We'll be posting a new update tomorrow, and I will share that with Dr. Wells. But the previous 3 weeks, we were at 56, just under 110, and then we went to 340. That was not the way we wanted to be going. In the last 2 weeks, July 19th through July 30th, we had 55 cases in the age group 5 to 18. That's your group. And so when we start talking about bringing folks back to school, we're looking at a great many more people that are positive with COVID-19 right now. As the North Carolina Strong Schools Toolkit will tell us, when we have a positive case in the school, by North Carolina communicable disease law, we are required to figure out how to slow the spread. And they give us 3 options to do that. Option number 1 is, well, first and foremost, we have to investigate. We have to figure out who has been closer than 6 feet for more than 15 minutes within a 24-hour period to others in the school. Then when we figure out who those folks that are close contacts are, we ask ourselves 3 questions. First question, was the close contact vaccinated? If the close contact was vaccinated, right now there is no recommendation for quarantine. That is a great way for your students 12 and older and your faculty and staff to stay on the grounds. The next question is, was the person they were a close contact to, did that person test positive within the last 3 months for COVID-19? If they did, they also are not instructed to quarantine. So another great way to keep people in the school. Not a great way, they've already had COVID, but thank you, Dr. Loda, for that.
They're all COVID, then they come back in 3 months.
Exactly. And then the third way is if proper mask use is in place by both the positive case and the close contact. If both the positive case and the close contact were wearing masks properly, no quarantine is recommended. That is significant. It is a huge change, and that for those reasons that I've just outlined, the Public Health Department recommends that all schools utilize all strategies available. Physical distancing, encouraging hand washing, talking with folks about symptoms checking before they even get out of the house to come to school, and then also to wear a face covering, because that will increase classroom time, that will decrease folks being out of work who are providing care for children, and it ultimately is our goal in Davidson County and your school system to keep kids in the classroom as much as possible. We anticipate that there will be cases. There were cases last year with other schools. We see cases in daycares. We know it's going to happen, but we want to keep as many students in the classroom as possible. So Dr. Wells, if you have any questions or your board has any questions, I'd be happy to answer them now.
I'm sorry, look at that. Do you know what percentage of 12 to 18-year-olds are vaccinated at this point in Davidson County?
It's a very small number. I don't have that exact number
No,
right
I
now.
figured you might not, but we're at what, 38, 39% overall?
35% fully vaccinated. The state of North Carolina told us last week 12% was in that age group, but that's not Davidson County numbers.
That's statewide though?
Correct.
Okay.
So, Ms. Combs, when you were talking about the quarantine process, now, I wanted to make sure I fully understood you. So, you were saying that if a student in the classroom tested positive, and if other students in there have been vaccinated, and they were within the 6 feet proximity, they would not have to quarantine, correct?
Correct.
And you, okay, because they've been vaccinated.
Fully vaccinated, 2 weeks after their last, yes ma'am, thank you for that.
What was that you said?
2 weeks after their last dose. So in your
Okay.
school system, most of them are gonna have to do the 2-dose series, so 2 weeks after that second Pfizer shot.
And then you said the next, person, what was that next person that was, with, you know, in the space of that positive, what was that next thing you said?
I believe you mean the next part was if they had tested positive for COVID-19 themselves within the last 3 months.
Uh-huh. And so if they tested positive, they don't have to,
Correct, and I went round and round with the state on that to make sure that I brought y'all the most correct information. If they have tested positive, the risk for reinfection within 90 days is incredibly low. So low that they do not recommend using the quarantine to slow the spread at that point.
so are you saying that that positive tested kid can keep coming to school?
Well, when you,
After their 10 days.
after their, yes, correct. So once you test positive, you are now under isolation orders, which is different from quarantine.
Okay.
And that's a 10-day period usually, but it's 10 days and you have to be fever-free for 24 hours.
Okay.
So once they've hit that mark, then they can come back to school.
So the difference between quarantine and isolation 10 days, quarantine is what?
Okay, so that's another 3-part system. None of this is easy. Quarantine is what we like to call questioning. We are questioning if you're gonna get sick. Isolation is you are sick, you are ill. So that's how I remember it in my little brain when I try to keep this up. So the quarantine for folks who are not sick is very, very most strict way, 14 days. That means that you are staying away from people for 14 days. There are some alternative options that you can choose to use. Alternative number 1, 10 days. If you would like to use the 10-day option, as long as the close contact does not experience any symptoms, they can come back to the land of all their friends, but they have to wear a mask, regardless of any masking policy that you may have. As I told the superintendents when I met with them and their representatives, that gets a little tricky with some of the rules that you have related to FERPA and HIPAA, because then if you don't have a mask policy in place, you let a kid back on day 11 and then that child is wearing a mask, you're sort of letting everyone know, hey, they have been on quarantine, which is a violation of their rights. The third option is 7 days. 7 days is able to be utilized if day 5, post your exposure, you go and get a COVID test and it's negative. But with day 7, you also have to wear the mask for the full 14-day quarantine period.
How many cases did you say we now have in Davidson County?
Oh, right. When we ran the numbers last week, we had 340 cases in the last 10 days. Yesterday, our percent positive number, which that's the one that the governor talks about a lot, we always are trying to keep low. Yesterday in Davidson County, it was over 14%.
So what, to that question I just asked, to get clarity on it. So, the kid that, that's been in, the same space with someone that tests positive, the student, they will, the administration will look at those 3 options that you described
Yes, ma'am.
to determine whether they come back, whether they isolate, or whether they get quarantined.
It's just if they come back or quarantine. Isolation is automatic if you're ill. But quarantine is that questionable period. So when you have that student, to follow your example, you're like me, I do an example. You follow that student, the school, we provide them with a flow chart that kind of helps them do that, but the school's gonna have to investigate who was within 6 feet of that individual for a 48-hour period prior to them getting sick. That's when the clock starts, and then you have to go back and investigate. all of that to see who was close. So then we got our list of close contacts. Then we start marking them off if they're vaccinated or if everybody was wearing masks. That was a little bit simpler. If nobody's wearing masks, then we're looking at vaccination. And then in the younger students, I mean, that's not an option, so that's a really easy one as well. It gets more complicated when you're looking at faculty, staff, and those 12 and under, when you start looking for vaccine status.
So the other fun part of quarantine that you didn't explain is if a parent has it, it's 14 days till the parent is done with their isolation. On day 10 of parent's isolation, then kids' 14 days start.
Yes.
It has nothing to do with when the person in the household tests positive. Everybody's 14 days doesn't start then. Everybody's 14 days starts when that first person is cleared, then the 14 days starts from that. You're better off to have COVID if you live with somebody who has it because you get cleared sooner than you do if you're in quarantine.
Dr. Loda is correct. We were able to work, especially in the very beginning of this, when we had
Which is why people aren't going to get tested.
That's a very good point too. When we first started this, we were able to talk with folks about isolation within the home, but if you have a small child, we all know that they need to be cared for, and so that's impossible. But for adults that have children that are 16 and up, we were able to walk through, and spouses and things where folks stayed in different rooms and used different restrooms, but that was very rare and not usually the case. So most people had to wait until day 10 and then start their 14 days, or 10 or 7.
Which means siblings have to stay home, which means everybody else, yeah.
Ms. Coates, can you speak a little bit to the CDC and Health Department guidelines related to transportation or buses?
Correct. I'm sorry, correct was the wrong word. Yes, ma'am. I'll be more than happy to. You said them right. You did that, but yes, ma'am. So because we have a lot of mitigation strategies to slow the spread of COVID-19, hand washing, physical distance, open air, things like that, the CDC looked at transportation differently because we don't have those in there. I don't need to tell y'all how much it costs to run a school bus. I don't know, y'all know a lot more than I do, but we put as many children as we possibly can on the school bus in a safe way because they're expensive to run. So the CDC said, hey, if we're doing driver's ed, if we're riding an activity bus, if we're on a school bus, there's no free flowing air, we're really tightly packed, masks are required. That's what the CDC says for that.
And did they speak to how many kids could sit on a seat on the school bus?
With the mask, current guidance is if it's a 2-seater, they sit there, they're front and back because we're properly wearing our mask.
So 14% of cases in Davidson County is about, how many? 428, 429 cases.
The 14% is the positivity rate. So if they did 100 tests in a day, 14 of them were positive. We'd like that number to be below 100 because as Dr. Loda mentioned, not everybody gets tested. So when we're looking at the test and the positive test, we know as public health professionals, that is a small piece of the number of people who are actually positive. The state and the CDC talk about a number below 5% to be in a good place, and Davidson County is over 14.
I was talking about the positive cases in Davidson County. 14% is like, what, 428, 429 cases we have positive in Davidson County. COVID tests. 340.
I'm sorry, I threw a lot of numbers. Yes, ma'am.
Yeah.
340 was our 10-day count last week.
Okay, thank you.
Yes, ma'am.
Any other questions for Ms. Coates?
Just like to thank you for coming out tonight and explaining this or trying to explain it to us. And all you guys have done over the last year and a half to keep us safe.
Well, you are welcome. It has been my pleasure, and we look forward to seeing y'all at Open House, where we'll be here providing vaccines with parental consent. So, and we are very much.
You are having daily, for the parents who are interested, you still are having the daily for the 12 or not anymore?
Every day, 8:30 to 4:30. No lunch break. Walk in. We'll get you quick and out.
Walking like every month.
Yes, absolutely. We'd love to see you. Yesterday, I pulled the numbers. We did 99 vaccines yesterday, which was good. I don't know where we were today. I was preparing for some other things, but yeah, every day, 8:30 to 4:30. We'd love you to come out. 20 minutes all it takes.
I did want to ask you this, is there are you finding here in Davidson County, as well as, I guess, across the state, reserve, parents reserve as far as their children being vaccinated because they still don't feel comfortable? I mean, are you getting that feedback?
Yes, ma'am. I'll be honest, that feedback is fewer and further between now than the political divide. The things we're hearing right now are really more political, my body, my right, you don't tell me what to do with a mask or a vaccine. But yes, we do hear that from parents. What's interesting is when I talk to pediatricians, they're all recommending it to the pediatricians I talk to, which, depends on who your audience is. When people talk to the public health director, they usually say things the public health director wants to hear, like vaccines. But yes, we are hearing that. We also, to full disclosure, hear a lot about young women who have heard some concerns about fertility, and so that is a question all the physicians I've talked to in the studies I've seen and been made aware of say that that is not an issue. I have 2 children. The 11-year-old is counting the days until her 12th birthday to get vaccinated. The 13-year-old is vaccinated. Their pediatrician strongly recommended it. So,
With the parental consent, do they have to sign, do they have to be present both times?
no, sir, just one, and we'll keep it on lock. And it says that we will have it with us, and it talks about it being a 2-dose series. But that was important to us as a public health department because we don't want anybody to think we're trying to do anything behind parents' back. If the student comes to the health department, it's a little different, but on your school property and school-sponsored events, we require parental consent.
And you may have said this, but has there been, and not necessarily in North Carolina, but anywhere, has there been any who tested positive in the younger age group who were fully vaccinated?
I don't know that data. That's a really good question. I would like to know that myself, so I will look into that.
So if you're coming on the 12th to do a vaccine clinic here, are you coming back then 3 weeks later here to revaccinate? The second, okay.
And
So
we'll
it's
also,
not that for the second one, they'll have to go to the health department, they'll be able to come here.
correct, but if they can't make it here, again, we'd love to see them at the health department.
You will have first doses the second time around, correct?
Yes, sir.
Oh. Any more questions?
I just got some question to ask. How about the card to get out of the coach shop? I heard something say that they have to be around the vaccine or certain things. Some people saying don't laminate them, laminate them. Have you heard any different that kind of thing?
No, and I can tell you too, we have a medical records department at the public health department, so if you need a new vaccine card or you want a different format, we'll be happy to give it to you. So if you wanted to have one laminated and you didn't want to have one laminated, we'd be happy to get you that.
Did you repeat his question?
I'm sorry, he has, in regards to the COVID-19 vaccine card that you have, some people are recommending laminating it for travel so it stays in better condition, and then some folks have said, no, don't laminate it. I haven't heard from an official source that lamination discredits the validity.
Any other questions for Ms. Coons?
Thank you, Ms. Coons.
Thank you. Y'all take care.
I will bring up what I brought up last time that was still unpopular. I would still like to require that mask for everybody.
I think that's the next thing on our agenda. Dr. Loda, I think next up is over the school protocol. Dr. Will.
So as we consider bringing our students back to campuses, we will continue to do our daily cleanings in our schools, and that means wiping down all of those high-touch areas, disinfecting restrooms in our facilities at least twice a day, reviewing cleaning and sanitizing protocols and expectations with all of our custodial team and our maintenance department, making sure that we are replenishing the teacher caddies that we issued out to our teachers last year that contained sanitizing devices or cleaners, gloves, anything they might need in order to do a quick cleanup of some kind if they choose to in their classes. We have provided new teachers with the same caddies today so that they can have those in those classrooms. For those teachers who've left us and have left their caddies in their classrooms, we will go out, pull in those caddies, hold on to those, make sure that we replenish them in the event that we need additional caddies. Teachers in our buildings will be able to continue to use desk shields for small group instruction or any special activities that they might choose to do in their buildings. It is not actually a requirement, but some of our teachers are very comfortable with them, like them, and some don't. So that will be at their leisure. All schools have additional stock of these desk shields in the event that teachers need more than they currently have. Students will continue to mask on buses. As you've heard Ms. Kuntz indicate, that we need to make sure that that continues to happen, and we will continue to follow all CDC and the Department of Health and Human Services guidelines and recommendations. We need to have a decision from the board about whether or not, or how, when, where, or if we will consider masking. So that is a conversation that is open.
Well, your very last sentence, we will follow all CDC guidelines. The first thing I heard on the news this morning is CDC is now recommending everybody in K-12 schools mask. So that follows the CDC guidelines. It's going to be so much easier when it does come through to have everybody have a mask on rather than trying to figure out who has to quarantine, who has to isolate, who has to, when they can come back. If you leave it up to students that it is a voluntary thing, part of the problem is the ones who, if they're vaccinated, a lot of times they're more willing to wear masks. Some are vaccinated because they don't want to wear masks. But then all the others who are not vaccinated or not tend to, but a lot of times are also the ones who don't want to wear the mask. If our percentage rate of vaccinated is 37% of fully vaccinated in Davidson County, and you're supposed to wear a mask if you're unvaccinated when you go to Food Line or Lowe's or Walmart, I promise it's not the 35% that are fully vaccinated that are there. I mean, you walk in there and almost nobody has a mask on. So if we leave it up to the students, even the ones who are willing to wear a mask probably won't because of peer pressure not to. You can't make it that, okay, the vaccinated kids don't have to, the unvaccinated kids do. There again, that goes against HIPAA and everything else, and if we can't, that's way too hard to enforce. It just, they're pain, I know they're pain, but they're doable. They're not awful. You get used to them. If we just make everybody wear them for at least the first 9 weeks, and then we can see where we're at. And if you're following CDC guidelines, yeah, that's masking at this point. I mean, I know I'd be an unpopular person for saying that, and I know not every kid likes to wear them. But if we have them in school and that's our main goal, we're not going to get all of them vaccinated. We can't, even if everybody 12 and above is willing to get vaccinated. You still have half of our kids that can't.
So last year, at the end of the year, were we providing masks to students daily?
For anyone who needed a mask, yes. And during summer school this summer.
We have plenty of stock.
We do have plenty of stock. As a matter of fact, we've sent communication out to our principals indicating that we still have plenty. They still have some in their buildings. So we've got more masks than we need.
And Dr. Wells, I mean, I do concur with Board Member Loda. I know I made it a purpose to listen to the governor whenever, you know, he gave the press release, and he just kept honing on the data. And he was, and one of the things he was saying that the danger to the students, that the students face, based on data, with them coming back and not being protected. And so, of course, it is an inconvenience to everybody, but inconvenience and, it's like being inconvenienced and bringing our children back to school versus them, ending up, everybody's virtual again because of not being protected, because the data is there, 350, 340 cases in Davidson County. So, yes, I'm 100% for the mask, and I do, say that, like you had said, that we get whatever equipment and stay stocked up on however many masks we need to order so we can be able to provide masks to children. And I know some kids are probably, when they put the mask on and they go home, they probably don't have them when they come back, same one. But if that's what we gotta do for their protection, then that's just what we have to do.
I don't think there's an argument about not wearing masks. I think everyone is okay with that. I do have some questions, and I was looking at Gifford County's mask policy. And in regards to high-risk extracurricular activities, and they're requiring testing, and they're requiring to notice the vaccination status of employees, coaches, and students who are involved in extracurricular activities. Is that something that we can look at, or that is to avoid clusters, as it states here?
Board Chairman Horton, we can look at whatever you,
Right, I understand.
all as a board, choose for us to.
I said we do that if they're playing, involving extracurricular activities, that when they were being grouped, those individuals should be, tested before they get, about like what they're doing with the Olympics.
Correct.
So most places will do, if you're not vaccinated, you have to be tested. The problem becomes that it makes it hard because of the HIPAA thing. And so, I guess the only thing is you have to take that into consideration.
But we
That
can,
will make it harder.
but we can create policy
Yeah.
to say, in order to take place these activities, you have to you have to be tested.
Either show proof of vaccination or be tested.
Or be
weekly.
tested.
That's exactly what-
So we had, so we did have some conversation on Monday. Ms. Kuntz, are you still outside? So we had some conversation on Monday about testing of students. Can you kind of summarize that conversation for us?
Yes, I'd be happy to. So testing is, as I'll say to everybody, a point in time. When you get COVID-19, you take a test 1 minute, and then in the next 30 minutes it's positive, but it was negative the first time. So we try not to live by the results of a test. Tool, yes, don't live by it. We do recommend in high-risk sports, like the first thing that comes to mind is something like wrestling.
Right.
Literally cannot stay away from basketball, football, things like that. Implementing some sort of testing. The state is willing to do that for you. We gotta let them know by September, I think.
Yes.
If that's what you wanna do, and then they will take the burden off of the school system and do that. However, when we do testing, if that is what we're going to do, my recommendation, and I would provide this to Dr. Wells, would be, as soon as you know the list of kids that are gonna be, interested in doing this event, you go ahead and test them and get a baseline, because some people have an infection from 2 months ago, and they're still gonna test positive. So they go ahead and start the clock. There's no way for us to determine that with the test, and it's infuriating. This year when we started summer camps, We had a bunch of kids that had to get tested before summer camp. They tested positive. They weren't sick, but they remembered a few months ago they had some sort of sniffles that didn't think it was COVID. So my recommendation would be you develop a baseline for the students that are going to be part of the testing program. And unfortunately, that baseline is probably going to kick up a lot of positive cases for unsymptomatic individuals. Regardless, they will still have to isolate for 10 days because there is absolutely no way for us to know if that is a brand new live infection that they're testing positive for or an old one.
So actually, they should be, even before, I guess, football has it started for about practice or whatever, that they should be actually being, the baseline should be done like now.
That's what Secretary Cohen continues to tell everybody. Get tested, get tested, get tested. And that's one of the reasons and benefits to do it. If you've got something coming up, go ahead and get tested now, because if you're one of those unfortunate folks that has an old infection, is what I'm calling it, you're going to be positive. And you're like, well, I feel just fine. Why is this an issue? But you've got that positive, you do your isolation for 10 days, and then you're ready to go to school, to play sports, whatever the case may be.
But you gotta go back and take another test after that 10 days to make sure you still not.
Nope. And then when you start doing if they are involved in the schools and they want to start participating in the sporting events and you're doing those routine testing, you're like, oh, I tested positive. And then there's that 3-month window. These would be things.
So they get out of it for 3 months then?
Correct.
Correct.
All right.
And how frequently would they be tested?
That is something for us to really look into. I don't have an answer for you right now. It depends on the frequency of practice, matches, things like that. Different sports would be different things. And I'm saying sports, there may be other high-risk activities, and I apologize if I'm, like bands and chorus and things like that, they're doing that. That might be a high-risk activity too,
So can you speak to the kid who says, but I'm vaccinated? Why am I continuing to test?
Well, they call breakthrough cases, and really some of my public health friends and I kind of joke, it's not a breakthrough because the vaccine does not stop you from getting the virus. It makes it less likely you'll get the virus, but most importantly, that vaccine will keep you out of the hospital most likely. That is what we're trying to do and save lives. So, even if you've been vaccinated, you can still become infected and you can still spread the virus. It's a lower risk and a lower chance, but it is still possible. And to protect your school, protect your families, we would recommend testing for high-risk activities, even for those who are vaccinated.
And then you can get around the difference, because then you don't have to say who's vaccinated, who's not.
So this would include coaches as well, and employees who are like band director, chorus director, anybody who's directly involved with those people who are in those high-risk activities.
But I guess my thing would be, I mean, band and chorus, I guess band, you don't, if it's you wouldn't have your mask on, but like chorus, you could technically sing with your mask on. So those wouldn't necessarily have,
No, well,
you can sing with your mask on.
so,
Versus like instruments where you have to blow into the instrument, obviously you can't do that through a mask. So those, I mean, does that mean you have to test everybody in band class?
I would say yes. I mean, I guess you could draw a line for a drummer that's not taking off the mask and doing that. But again, if the drummer is closer than 6 feet to the guy playing the saxophone, he is wearing his mask, but the other guy's not. So that's,
Right.
so with the football, does it, I mean, like, so would they have to, like, early before the game or whatever, would they have to be like,
I don't believe that is the recommendation. I think that it would be to determine a time that would be as least disruptive, like maybe start your Monday practice, your Tuesday practice, whatever practice with the test. We get the results and we go from there. That is something that the state has not talked with us about specifically because it is a school.
So do you do the rapid test or do you do the overnight test?
I believe they were recommending a rapid test, Dr. Wells, do you know?
I believe that is accurate.
Okay.
Which then becomes another problem too, and Dr. Lodo, I'm sorry to speak, but that's something that you're gonna have to get with your plans. If you've got a bunch of kids and they don't have transportation and you're on the side of a football field or at a wrestling match or at a band and you tested positive, where are you gonna put them?
Well, that was my question. I mean, do you test them Wednesday after practice so that you have the result Thursday afternoon? Or do you test them?
The state has this really a good idea and a good plan. They're just waiting for school systems to say, hey, we want to be a part of it, and I think they will help us with that.
Okay.
So when would they roll that out?
It's at the request.
As soon as we say.
So if we say we want it, they come and talk with us
Correct.
tomorrow, the next day, or whenever. Okay.
And when's that decision due by, what is that?
I believe, Dr. Wilbur,
Sometime September.
yes, this morning they talked about that. And then you get in line, and they've established areas of the state who would serve you. You just gotta let them know that you're interested, and they're chomping at the bit to get a hold of us, because they want to do this, that is their goal.
So we want to do that.
Yeah. when you're
I
at
don't
the
see
top.
it wrong. John?
Well, I think we need to figure out what it is we want. There's a lot of variables there. How frequently do you do it? What test do you use? And
Well,
what's
that's
Well,
what,
the state is
that's
requiring
right, that's what the
The
state
state
will
is.
come up with.
I think they'll work with us. They'll pretty much hold our hands and say, okay, this is the score, this is the practice state, these are the game state, this is our recommendation. Something else for y'all to just put in the back of your mind too. Every day, they're doing testing at the fairgrounds. So if y'all decide this is the way y'all wanna go and y'all wanna share with your, student body and everyone, hey, you wanna go ahead and get that baseline test, free of charge, run up to the fairgrounds, they can get it done. It's from 10 to.
But they could do it at football practice too. I mean, football's already practicing. You do your
Oh,
baseline
yeah,
and
well,
practice
if
one
they can
day.
get over here and get it done, absolutely.
Okay.
All right, thank you, I'm sorry.
Thank you.
Thank you again.
Well, is that something, I guess, that's something that we want to,
Okay, I'm for it.
so I guess there's two different motions then. A motion for mask, if we want to mask, and the other one would be for, the testing, I don't know, what is it called, you know?
Routine COVID testing by sport.
Participate in the state initiative
Okay,
for testing and I guess monitoring of extracurricular activities, in collaboration with the board. And maybe if you have to tweak that to identify with the state's advice, what activities does that include? But it sounds like to me it's a participate in that
Right.
initiative to cover extracurricular activities that are high risk.
Is the math recommendation on school property or just in school buildings?
It is in schools. They have,
I would assume that's in school buildings.
yes, in school buildings.
So I'll make a
So-
motion.
So,
And
okay.
transportation.
So, okay, so say for instance at the high school, we have the, is that like the commons area where the gazebo is and so forth? If you have a group of students, high school students, that's on the outside, that's not in the building. So that, they still, masks still should be worn because of the close proximity. So that's not in the building though. So things like that, we need to, be specific about.
school grounds.
So on the whole school grounds, we need to observe the mask, Because you have, just like say for instance, another example. Kids are coming, the bell rings, and it's time to go home. Kids are coming out the gym, door out there. Well, a lot of kids congregate coming out that door. Well then, if you have kids say, well, I'm on the outside, I'm taking my mask off, you got a group of clusters.
So I move that we require mask use on school grounds for the first quarter of the 2021.
So a motion by
K-12.
I'm sorry. So,
The pre-K.
during the time when students were in school, with masks, we were allowing teachers, as they took kids outside to PE, to have a mask break. So are we taking that option away?
So what would be the stipulation?
You're more than 6 feet away outdoors.
Is that what?
That's exactly
If you're
right,
more than
Dr.
6
Burrow.
feet,
6 feet away.
they are like, you can make a mask break if they are outdoors and more than 6 feet away from others, so that you can spread them out.
So
Then they can have a mask
teachers
break.
can, stipulating the teachers can.
The teachers, I guess, could
But-
allow students to have a mask break outside if the students remain at least 6 feet apart from each other outdoors.
Right, but when it comes to, leaving out of the school building, they're still required to wear those
Because
masks
they wouldn't be more than 6
because
feet
of the
apart.
clusters.
Yeah.
Did we have that 6-foot language for teachers? Guidance?
I don't remember that, but we can make sure that that is a part of the language.
All right, so I'll amend my motion to add that we would allow outdoor activities that are controlled with folks 6 feet apart to be masked.
With the teacher giving that, right, John?
It's his motion.
They need to specify teacher control.
I would just say as staff monitors,
Okay.
to make sure that students are 6 feet apart,
Okay.
which is going to be hard, as Ms. McDuffie has indicated, with the buses and kids getting on and off buses, especially at the high school, because of the numbers of kids. That may not be an option for not wearing a mask. I mean, kids have to have a mask on in that situation because there's so many of them together, and they are definitely not 6 feet apart.
Okay, so read back to me what you have, Mrs. Flicker.
Motion to approve a mask wearing policy on school grounds and on LCS transportation for the first quarter of the 2021 school year for grades K-12. Staff monitors can allow mask breaks for students outdoors if students can be distanced 6 feet apart.
The teachers or
Well,
should put staff.
I thank you for saying that, because that's too long for me to remember as a motion. So we have a motion by Mr. Vice Chairman Burton.
I said, should we change teacher to staff?
That's his
Oh,
motion.
staff, never mind, okay.
So we have a motion by Vice Chairman Burton,
Second.
second by Dr. Loda. All right, motion passed.
Okay, so can I make a motion that we, with the help of North Carolina Health and Human Services, test,
I think it was a participation of state initiative to cover high-risk extracurricular activities.
okay, yeah, that.
Kind of say that.
Participation of the state initiative to
To test students who are engaging in high-risk activities such as sports,
Then, of course.
band,
high-risk
Yeah,
just high-risk
extracurricular.
extracurricular activities.
So a motion by Dr. Loda to participate in the state initiative for high-risk extracurricular
For
activities.
testing for,
Have a motion by Dr. Loda, a second by Ms. Duffy.
we'll hear about that one when I get home, I'm sure. That's okay.
All right, motion is passed. Thank you. All right, next is the public relations. I'm sorry.
I just have a question in regards to, maybe concern. First, I might need to make a motion to turn that fan on over
Anybody second that? You're breathing.
Go ahead, I got a coat on, go ahead.
Okay.
I'm gonna ask about, as far as, open house, and I guess, that's not, I guess, so is that set up now to everybody invited to come in regards to the school, or is that up to how the principals, how they want to do it, they want to stagger or do some different way, how does that work?
That is up to our principals in our schools. We have made sure that staff would be available between noon and 7 p.m. for folks to stagger in, so we don't have a scheduled time for everybody to be in the building at the same time. This allows for some flexibility for our families, so that we make sure that we provide them with as much opportunity as possible to get to open house. We do have at our high school where there's going to be a freshman and a sophomore orientation that will be held in the morning. We've got 2 groups of kids at the high school who have not been in the high school. And so this is an opportunity to bring them in prior to the start of school, to get them acquainted with the building, some of the policies associated with being in high school, or the expectations of being in high school, and just an opportunity to meet teachers and make sure they don't get lost in the building during their first couple of days.
In regards to us making mask requirements, because I'm on the assumption it's probably going to be a headache for some of the administrators and staff, I guess, when we have some that just don't want to follow the rules. I mean, is that kind of worked out with the different schools and administrators in regards to what's going to happen, what that consequence is in regards to that?
Well, I mean, if it is a policy, we are going to expect that everybody enforces that policy. And so that would mean, one, you've got to make sure that if the kid doesn't have on a mask, that you offer the kid a mask. If the kid decides that he doesn't want the mask, then we've got to pick up a phone and call a parent, take the kid to the sick room and say, your child has to have on a mask to stay in school.
So, and that may be a question that you just asked, Mr. Waller, and I didn't hear you, but there should be some kind of guideline as far as measures, if that, because they have to be held accountable, because that's why they're in school to learn.
That is correct.
And so there's got to be some kind of guideline that say, okay, this is what happens when you don't wear your mask or if you refuse to. And even calling the parent, what if they can't get in contact with the parent?
Well, we do have what we call sick rooms that we established, and those students can go into those locations until we can make contact with the parent or to get the child home.
And that's also something the teacher can do the first few days of school, is go over the rules.
Yes.
Reiterate those first few days. These are the rules when it comes to wearing your mask.
Absolutely.
But definitely make it clear and open house.
Yes.
Yes. And then
Yes.
Have something on paper to hand them.
Yes.
Give the parents something in writing during open house. These are the rules for it, you know.
And these are repercussions for not wearing the mask. So you have to, you just have to put it out there plain.
We can work together too, there are certain limited exceptions that I think would apply.
Yes.
So, and that's part of the toolkit also, so I think that would be something at least the staff needs to be aware of, that there could be certain limited situations.
Sure.
The vaccine clinic at open house, is it at the middle school, at the high school, or at each school?
It is at the middle school on
Open house.
open house the 12th from 3 until 5, and then it will move to the high school on the same evening from 5:30 until 7 o'clock.
Okay. Can we make sure that there are one or two announcements sent out? So
Absolutely.
that people who were planning on coming, if I was planning on coming at 1, but now know that if I come at 3,
You can get the
I can get the vaccine also.
Absolutely. I've asked the high school and the middle school principal to make sure that that is included in their correspondence home
Okay,
to families.
okay,
And we'll make sure that we put it on our website as well.
okay. Thank you.
Any other questions regarding the school protocol?
And will parents be able to get vaccines when they're here with
Yes.
it also? Can we
Yes.
also mention that?
Absolutely.
Parents know and think about if they want it.
Sure.
Okay. Thank you.
Mhm.
I do want to ask one more question regarding that. What if a parent comes and says, my kid has a medical condition?
That's what he just mentioned.
You get a note from your doctor, and there are very few things that will actually give you a medical exemption from a mask.
That's what David just said he would give us there.
I mean, the ones who want it, who have asthma, who said they can't breathe with it, are the ones that need it the most, because they have, so there aren't any things that will get you a true exemption, but there are some.
Any other questions? All right, thank you. Public relations position.
So on the 16th, I sent you all an email regarding some thoughts about the hire of a part-time public relations person. And so at this time, I'm hoping that you all have had the opportunity to look at that email. My initial thoughts are that we can fund that position with some of our ESSER dollars, as I outlined in that email. And I've indicated to you the 2 pots of money that we could utilize to staff that position. Again, it is a part-time position, so we anticipate a salary somewhere in the neighborhood of about $25,000 for the part-time position. Yes, Ms. Riddell?
Why is it only a part-time position?
When I say part-time, I mean about 20, 25